Today on Let's Talk Schools, we're going to be talking about everything related to school safety, from policing to health services. Hi, I'm Mike Loney, the Superintendent of Schools. Welcome to Let's Talk Schools here in Fulton County. Today's focus is going to be on school safety, all things school safety. We're 2 days into the school year, and I have two very special experts on school safety. First, our Chief of Police. Mark, if you'll introduce yourself.
Yeah, Dr. Loney, appreciate you having me here today. My name is Mark Silborski. I'm the Chief of School Police here at Fulton County.
And tell us a little bit about yourself. How long have you been with the district?
Okay, with the district, I'm going into my 20th year.
20 years.
With the district, yeah, and this is 26, just over 26 overall, going on 27 in policing altogether.
Okay, so you're a very experienced police officer. And so did you rise through the ranks to become the Chief of Police here?
I did. My first assignment was actually a high school-based officer, and yes, worked my way all the way up through the ranks up to Chief, and was appointed into the Chief's position about 5 years ago.
Okay, well, we're going to talk a lot about the policing part of the work. A lot of people might be surprised that Fulton County Schools actually has a police force,
Sure.
But everything that we do is not related to police work. Most of the work that we do is really related to about student health. And we have the good fortune of having Lynn Meadows here today. And so Lynn, if you don't mind, tell us a little bit about yourself and what your title is and how long you've been with the district.
Sure, so thank you for having me also, Dr. Loney. I'm Lynn Meadows, I'm the Director of District Health Services, and I have Chief beat a little bit. I've been here for 22 years. And so I came in 2000, and I came and I've been here since the inception of the program.
Wow.
So I came from Grady Health System as the Assistant Vice President of Nursing and came here to implement and develop the School Health Services program here in Fulton.
Now you have some tall orders. You have to make sure that our students and staff members operate in a healthy environment. We take care of everything from the sniffles to pretty significant injuries
Yes.
in the district. And so we're going to dig into that. Thank you both so much for being here. And so Chief, I'll start with you. How big is our police force? Why does a school district have a police force? Tell us a little bit about the department that you oversee.
Okay. Basically, our department is, if we want to start off with size, we're probably considered a medium-sized agency in the state of Georgia. We're staffed for 88 police officers altogether. We're kind of broken up into a couple different facets. We work very much like a traditional police agency would. We do have school-based officers. We have officers that are non-school-based that are out on patrol. We work a 24/7 kind of shift where we have officers working all night, so they're protecting Board of Interest properties at night and from burglaries and property vandalisms and those type of things. But we do, and obviously our bread and butter, so to speak, is our school-based police officer, because that's the one that has the most interaction with our students and our staff and our parents. So it's very much a integral part of the policing environment. And I think as educators know, if you don't have a safe place for kids to learn, you can't teach. So and our philosophy over in school police is basically a twofold facet. We've got building relationships with students and staff, and all of our folks that come into our buildings every day is probably one of the most important things we do. And then we enforce laws. And I tell people all the time, we're really not there to police kids. We're there to provide a safe environment for them to be able to learn.
Right. That's a good point that you make. So if a student is misbehaving in a classroom or in the hallway, the school administrators, I suppose, deal with those types of conduct and misbehaviors instead of the police.
Yeah, we don't want to be the heavy hand in any of that. We're not classroom managers. We help guide folks through all those issues that do come up during the day. We want to be involved in the things that go on during the school. I think we can make a positive influence in some of those things, but we're not the heavy hand of discipline. That is not our job. It's not our role. It wouldn't be the role of a police officer out in the public either. So it's very much an important part of what we do to help support the staff that's out there doing the administrative work, but our hands aren't going to be directly tied into the administrative piece.
Right. So the primary function then, it sounds like it's really much like the old community policing model.
Sure.
You're there to prevent, you're there to build relationship, and then in the case of a commission of a crime, you're there to respond.
Sure. And in kind of old term fashions, we're the cop on the foot beat.
Okay.
We do have cars, we get places, we do have a lot of places across the district that we have to get to. We've got so many schools spread out all over the county, but we do need abilities to get to those places. But the traditional piece of the policing part that we do is walking the foot beat. It's like the old time police officer that you used to see in a downtown center, walking in and out of stores all the time and get to know the shopkeepers and the people that were on
Sure.
his beat. And it's really no different. There's some of those old traditional pieces of the way that policing used to happen on that level have carried over into what we do in the schools. Each one of our schools is kind of its own little town, so to speak. And it gives us an opportunity to be that police officer on that foot patrol inside that school building relationships.
Well, we're all focused on school safety. There's been a lot of school-related issues across the country. We're all kind of on heightened alert and very sensitive to all the discord that's happening. I'm going to come back in just a moment and ask you about the relationship that exists between our police force, which is it's a post-certified, full-fledged police force with arresting powers, investigative powers, and everything that comes with it. But I want to talk about the relationship that we have with the local municipal law enforcement divisions. But before I do that, I want to turn my attention to the infamous Lynn Meadows. Lynn, everybody in the district knows you so well and is so appreciative of the work that you do. Talk a little bit about our school nurses, the clinic assistants, and how we operate as a school district, if you don't mind.
Sure. So we have an amazing district health services team that is comprised of registered nurses. So there are 19 registered nurses, there are 6 special education nurses, and then we have a full-time clinic assistant in every one of our schools that are in our clinics every single day. And so together we make up the district health services team. And our mission is really simple. We ensure the health and safety of our kids in the sense of when they have health-related issues. So our mission is to make sure we address and manage any health-related issues. Those issues can span from kids that come in our clinics with chronic illnesses, to managing communicable illnesses, to any and everything that kids might need to see or come into our clinics. We're trained for that. We also do a lot of training. Speaking of training, we teach CPR and AED training to make sure our staff are knowledgeable in first aid and how to manage that in case the nurses are not there, so that we have that safety piece in place as well.
Right. I know that when I was in school, we didn't have the benefit of a school nurse, so we would go to the principal's office when we had scrapes and bruises and a broken limb here or there, and the principal would have to call 911 and the ambulance would have to come out. But our district has the good fortune of having y'all in all of our buildings, and then regional support for the folks that are in the building. Can you talk a little bit about how large your force is? How many people do you supervise in totality? And what is the most challenging part of your work in today's environment?
So I would, first in terms of staffing, so there are 26 registered nurses, but we also have other registered nurses that we contract with.
Okay.
And they help us with a variety of things. They help us sometimes with our kids who are medically fragile. We might assign a one-on-one nurse with them. We also have our case investigators that help us with communicable illnesses. And then, as I said, we have for every school, so that's 108 clinic assistants. So the total operation under my shop is about 130 between our nurses and our clinic assistants that work and cover, as you said, all of our schools, all of our school buildings, so that there's someone all the time. I think in terms of challenges right now, it's just making sure that one of the things that we always say is we're just like pediatric nurses out in the field. We have to keep up with everything.
Right.
We can no longer, and we have a little saying in student health services and district health services that says school nurses is far more than just Band-Aids now. We have to keep up with trends, we have to keep up with illnesses, how to manage that, because every day kids are at our schools for about 8 hours and parents are entrusting them in our care. So we have to know any and everything about those chronic illnesses like diabetes, asthma, sickle cell. So we have to stay well versed on not just those things, but the procedures, medications that we administer, and things like that.
So speaking of medications, just very quickly, we have clinic assistants that are supervised by school nurses. And so if a student requires medication during the school day, are they allowed to keep that medication on themselves? Are they required to have that medicine in the office, in the school nurse's office? How does that work for our parents?
So great question. And Fulton County, I'm happy to say, has a written, well thought out, planned medication protocol and procedure. So students can carry medications, but you have to be a certain grade level. And there's forms that parents have to fill out. And those forms simply say that we all, including the parent and that provider, have agreed that that child is able to carry those medications. And those medications are over-the-counter medication. So it's things like Tylenol, a cough drop. When we get into medications that have been prescribed, like antibiotics and things like that, then those medications, parents fill out a form that we have. It's a very user-friendly form. We have it online, as well as you can pick up one at the school or in the clinic. And that form is something then a parent and the doctor has to fill out, so that we make sure that we're giving that medication, administering that medication appropriately. And things appropriately meaning at the right time. We have the right students, the right dose. So we have a policy and a protocol that governs who and what medications can be carried versus which medications have to be stored in the clinic.
That's really good and powerful information. We don't want anybody getting in trouble, misusing medication, giving it to somebody else that shouldn't be taking the medication. So if there are questions, go to the clinic assistant, the school administration, they'll get answers to all of that. So Chief, I know we have a great police force, but every municipality also has a police force.
Sure.
What does that relationship look like between the Fulton County Schools Police and, let's just say, the City of Fairburns Police Department or John Creek, the police department? What does that relationship look like?
Well, I always go back to the old adage that there's nothing that doesn't happen outside in a community that doesn't find its way into a school, and there's nothing that doesn't happen in a school that doesn't find its way out into a community. So municipal partnerships are a primary concern of what we do. We assist each other all the time in investigations just because of the close, tight-knit community that happens between a school and the regular community that the kids belong to. So there's just always that back and forth. We have a lot of informal communication during the day. I think we're coming up with some pretty good plans to actually have some good formalized communication. And that has been spearheaded by some more recent events in past years and Sure. recently. That's we always want to make sure that we're playing off the same sheet of music. And make sure that we're all, know our roles and responsibilities, and making sure that things are clearly defined. And that's just, the communication is paramount. And, it always goes back to, having those built communications and knowing who to go to and know who to talk to. And we can't do their job without them, and they really can't do their job without us either. So it's very symbiotic in a Sure. relationship.
So we have a pretty good, strong working.
We have great relationships with all the municipalities. There's not a single chief that I couldn't call up today, or a patrol officer. And I think all of our folks feel that same way. They're always welcome in our schools to come in and and hang out and build those relationships with the kids too. So it's like I said, the having the overall piece of communication that goes on a daily basis is really good overall.
Thank you very much, both of you, for being here. We could spend hours talking about school safety. We'll invite you back to Let's Talk Schools and dig in a little bit deeper. Folks, I want to thank you so much for joining Let's Talk Schools about this important topic. I want to close by talking about two things finally. We tell our students and our employees, if you see something, say something. If you see something that doesn't seem right, if you see it, then say something. Should they contact you? Who should they say something to?
There's a lot of good ways that we have. We've got the link through the app on the app that goes on all of our mobile devices. The website has got the I want to report a tip type thing. All those tips come straight into us. If you have a trusted adult in a school, that can get information back to us too. You don't necessarily have to call us directly, but find someone that you trust. Especially
Tell somebody that you trust.
Just tell somebody and make sure that they get the information back to us.
Thank you so much. School safety is everybody's business, whether it's taking medication at school, whether it's a child that has a cold, a fever, an allergy, or whether there's rumors of a crime or a potential crime. School safety is everybody's business. This is a really important topic, and I know that since school has started now, that we will continue to focus on this very important work. And now, let's go around the district in 90 seconds.
Welcome back! We can't wait to see you! Welcome back to school! Welcome back to school! We can't wait to serve you! Welcome back to school. We can't wait to see you. Welcome to the new season.
Welcome back to school. We can't wait to see you.
Welcome back to school. We can't wait to see you.
Hi, I'm Mike Looney, the Superintendent of Schools in Fulton County. On behalf of our school board members, I want to say welcome back, students and families. We have been working tirelessly this summer to prepare for your return. It's going to be an amazing school year, and I can't wait to see all the wonderful things that we do together. That's it for our show this week. Let's keep the conversation going. We'd love to hear from you on our social media platforms. Join us next time on Let's Talk Schools. And thank you so much for watching.